Hi, I'm Natalie Cekovich. I have a doctorate in nursing practice, and I have been in the field of nursing for 20 years. I have seen a lot, and I'm here to share with you what I've learned about nursing school, the nursing field, and everything in between. Welcome to Ask Nurse Natalie, where you don't have to be afraid to ask. So today we're going to watch scenes from Noah Wiley's The Pitt. And as a nurse practitioner in the city of Pittsburgh, we're going to see if they're realistic or not.
No. Mel, I'll have you help
Okay.
with Robert's maneuver. Of course. Hey, Natalie, we're gonna lift your knees.
Okay, so lifting the knees up to the chest is accurate. However, usually you have to be at a higher height. So our nurses usually bring in stools at the bedside to give them leverage to get pressure on the mom's abdomen and get the legs back far enough. That looks real.
Keep going.
I'm Dr. Myers with obstetrics.
Nice to meet you.
And who's the father?
Oh, really not time to discuss that at this point.
We are.
So you really worry about a broken clavicle and something called a brachial plexus injury, which causes distress in the baby.
One good push.
Good. Hey, we got a baby boy.
The baby's not crying yet.
No,
That
try
looks
and stimulate vigorously.
more
No, no, hurry,
realistic.
vigorously.
Shouldn't he be crying by now?
Ooh, we don't slap the baby. So the Pitt did a really good job with that scene. That was really accurate. That's something that the labor and delivery nurses see frequently. When the baby was on the warmer, they began neonatal resuscitation. When the baby wasn't responding to gentle stimulation, I think they were slapping the baby's foot a little bit. We usually like to rub the baby's back, something a little bit more gentle, something to get the baby breathing. If that doesn't work, we dry suction and stim again, and then we begin positive pressure ventilation, which is what you see on the baby's mask, as they start squeezing the ambu bag.
Sats 99 on room air, normal BP, normal pulse.
Those are good vital signs so far. That's a real baby.
Could be a benign virus, but can't assume that.
How should we assess?
Under 28 days gets everything, including an LP, but over 28 days, you can follow PCARN or step-by-step to determine risk of invasive bacterial infection.
This baby looks great.
We know nothing about the birth history.
So this looks like a well-appearing baby to me. And she's mentioning some very invasive steps. I'm not sure that every hospital would jump to lumbar puncture with this baby based on the clinical findings or the baby that's presenting in front of them. But there are certain tests if the baby's sick and not well-appearing that they would run.
Did mom have group B strep, active HSV lesions?
The vital signs on the monitor look fine with the exception of the temperature.
CBC, blood culture, chem panel, chest x-ray, UAN culture, respiratory virus panel.
All appropriate things for a sick baby. However, their model does not look sick.
We don't call it a postmortem C-section anymore. It's a resuscitative hysterotomy to try to save them both.
But she doesn't want any medical intervention.
That doesn't matter. Mom and baby are both dead if we do nothing. Okay, charge the 200, one more rhythm check, and then Abbott and I are gonna cut.
No change. Resume compression and Pepe.
Okay, showtime.
We need to get this baby out right now. Take a break.
So this looks like a splash and dash where they're going to take the baby pretty quickly. It appears that mom has preeclampsia, which is a seizure related to high blood pressure. And the cure for that to save mom's life is to get the baby out.
Okay, Tembley. Good. First incision is from the xiphoid to the pubic symphysis, through the skin to the linea alba.
Well, incision through the lower uterus so as not.
So it looks like they did a classical T incision, which is not the normal choice. I'm not sure why they didn't choose to do a normal C-section, but maybe that's explained later.
Got it? Yep, I got it. Okay. Okay, using scissors to extend superiorly.
Breech position.
Breech meaning feet first. However, the head came out
Baby's
first.
out.
Keep the blue eye closer. She's really blue. Some blue is normal.
You need a heart
but not
rate.
this much. Do we need to intubate?
Not yet. No, they usually pink up with stimulation and blow by.
Okay, we're moving the placenta.
Sweeping
Nobody
to the left,
assessed
trying
the
to
heart
get it in
rate.
one piece.
It means we need
Okay.
back suction first.
Right. So a normal baby heart rate is above 100.
Charge at 200. Stand by for the next rhythm check.
Nobody's compressing the bag.
Bagging.
Pulse ox 45%.
We're worried about the heart rate. Okay, get ready with an IO in case we need epi.
An IO.
Rhythm check, hold compressions.
Oh no. Go through the umbilical cord.
Heart rate and pulse ox are trending higher.
Let's keep doing what we're doing.
So the baby's improving.
Heart's barely pumping his PEA. Back on compressions.
So you definitely see the need for two different teams here, right? You have two different crashing patients.
Lap heads we got, please.
I feel like there's a lot to dissect there. First of all, they did a classical T incision, which is like the last resort. So clearly that was a fake abdomen. But when they were trying to stop the bleeding on the mother, they were just shoving laps inside her, which are the cloths. So, you know, the big thing is to make sure that you don't leave those. So like there's nothing attached to them. They were just shoving them in to stop the bleeding. Usually the doctors will attach something to them so that they can remove them after the bleeding has stopped. In my opinion, they didn't jump through the hoops of neonatal resuscitation fast enough. But it is realistic in depicting the scene that, you know, a lot of times they think the baby is delivered and everything's fixed. So there's a mother crashing and there's a baby crashing, and there's a need for two different teams to be focusing on the patient. And a lot of times, you know, as the provider is working on the mom, they've got their eyeball over the mom's shoulder looking at the baby to see how that resuscitation is going too. So it can be very stressful. So generally, I do think that the writers, researchers, directors of this program do a great job at researching the real life medical traumas and what procedures would be done. And they do a really good job at accurately depicting what the scene would look like. Obviously, when you're in the scene, it seems a lot more stressful than they display as actors. I think they do a good job, and I think that's why the show is so widely loved and wins lots of awards. You can really feel the emotion and everything involved in it. Nursing school can be very challenging, and I'm here to help along the way. Follow along with Ask Nurse Natalie, and I look forward to seeing you again.